So we work in a field called regenerative medicine, but one of the main technologies we're of course working is 3D printing. Our 3D printing is a lot different, I guess, than what most people consider 3D printing to involve. Because we have a medical focus, we're heavily focusing on what's called 3D bioprinting. So bioprinting is like normal 3D printing, but with patient cells and also very, very specific materials.
What is so special about this kind of printing that you're doing here?
So what we want to do is fix really complex problems for patients. So again, we can take some sort of medical image, and then we want to try and engineer some sort of solution for that particular patient. So the way we do things a bit differently is that we print a very complicated shape out of a biomaterial. It has a very specific or very special purpose in the fact that it has to be safe in the body, and that it also has to help repair the patient's tissue, and also that material has to be very, very friendly to cells as well.
And I mean, this special material makes it a lot more complex. Can you explain a little bit what this material is actually made out of?
Sure. So what we're developing is essentially bioinks. So what we're trying to do is actually have our 3D bioprinter with different bioinks. So each of our inks can be have different types of cells in it, and a really nice environment that cells are very happy in is jelly-like materials. It turns out that the types of materials, including things like gelatin that are used to make jelly, can also be used as one of the base materials for things that we would use to develop a bioink. And then, yeah, our 3D bioprinter essentially is printing or extruding these bioinks, which have the cells in them to essentially then make us these really complicated tissues to try and engineer.
And once you have these tissues, can you sort of tell us what this would mean for the patient?
We can print those patients specific tissues that could regenerate the damaged bone or the damaged cartilage, and basically have them walking around sooner and never necessarily need that implant to be replaced in future. So it's sort of a next iteration of kind of the current technology around printed titanium. Wouldn't it be great if you could essentially print patients' own tissues or viable tissues to not necessarily always need a titanium implant? So the big jump is the combination of printing technology with the materials development to combine the two to actually allow you to start engineering patient's tissue.
Do you have any idea how far away the most simplest sort of use for these biomaterials would be?
Where this next stage will go around regenerative medicine is a bit still uncertain. Again, it's possible to engineer small pieces of cartilage or small pieces of bone, and those will come to market sooner rather than later, so within the next 5 to 10 years. And then, yeah, more complex tissues and larger tissues, it's hard to really gauge. People suggest maybe in the next 20 years, but you know, it may be more challenging than that.